Here we can dive into a brief biography about Virginia Henderson's young life and her upbringing. Born as the fifth of 8 children, she was born in Kansas City and named after the state of Virginia, where her mother longed to return to. And at the age of 4, Henderson moved back to Virginia, where she began to attend a prep school owned by her grandfather, which she continued the rest of her young studies at. During World War I, due to a strong sense of pride towards our country, Henderson joined the Army School of Nursing in Washington, D.C., and graduated from this program in 1921. Post-graduation, she began working as a public health visiting nurse in New York and in Washington, D.C. Unknown at the time, this work experience would support her theories well. In 1924, she began a role as a nurse educator at Norfolk, Virginia Protestant Hospital School of Nursing and served as the first and only teacher in their School of Nursing. In 1932, Henderson graduated with her bachelor's degree, and in 1934, her master's degree, both from Teachers College, a part of Columbia University in New York. Starting in 1934, Henderson continued to teach at Teachers College and practiced nursing for 16 years until she joined Yale University as a research associate in 1953. In 1955, she co-authored Principles and Practice of Nursing with Bertha Harmer, and this became a widely used book across nursing schools in the country. In 1966, she published Basic Principles of Nursing, which was translated across 27 languages, and this went on to be revised and republished in 1972. Also in 1972, she published a 4-volume Nursing Studies Index, and in 1978, the 6th edition of Principles and Practice of Nursing with Gladys Knight and 17 contributors, and this was arguably the most important contribution to nursing science in the 20th century. As she continued on with her life, she led other contributors to synthesize literature, and she traveled to speak at numerous societies, conventions, universities. And through her time, she received many honorary degrees and awards for her contributions to the nursing profession. In 1966, Henderson passed at the age of 98 in Connecticut, but her legacy continues to live on today. Here you can see a portrait of Henderson in her later life, as well as a group photo from her Army School of Nursing graduation in 1921. Below, you can see a picture of her receiving an award, as well as a picture of the 5th edition of Principles and Practice of Nursing. To the right, you can see Henderson's gravestone, which reads, Architect of Nursing. Philosophical underpinnings refer to the beliefs and values that build the foundation for a theory or study. The next few slides will dive into factors contributing to her theory creation and how they influenced its development. During Henderson's time, there was an empiricist era in the field of nursing and medicine. This focused on patients' needs and how healthcare professionals could guide and support them to promote healing. Additionally, during her graduate studies, Henderson was introduced to physiological principles, or the biochemical principles involved with the functioning of humans. As she began to understand both these basic and complex principles, they began to form the basis for her nursing theory. At the time, nursing was also considered a women's job, and it did not have a high recognition. Henderson wished to define nursing with its own theories and perspectives to additionally define its recognition and advocate for the professionalization of nursing. And lastly, Henderson's her professional work greatly contributed to her theory development, and this will be explained in later slides. When thinking about fundamental philosophies and disciplines reflected in Henderson's work, it becomes a bit difficult as her work is inductive, meaning that it derived from her own personal practices, education, and experience. McEwen and Wills wrote that Thorndike's fundamental needs of man influence Henderson's beliefs. This likely had to do with understanding our patient's needs. Additionally, her work can be compared with Maslow's hierarchy of need in terms of caring for a patient with a holistic view and including components such as physiological, safety, and self-esteem needs. Disciplines that can be reflected in her work include physiology, which includes nutrition, hydration, and elimination, psychology, as her theory addresses emotional and mental aspects, assessing emotional well-being, fears, concerns, and promoting coping strategies. It reflects sociology due to its addressing family dynamics, cultural beliefs, and community resources. And it also reflects education due to the nurse's role in teaching patients about health promotion, disease prevention, and self-care. As mentioned, Henderson worked as a visiting nurse in New York City. This experience enlarged Henderson's view to recognize the importance of increasing the patient's independence so that progress after hospitalization would not be delayed and that patients could continue their recovery at home. The empiricist era focused on observing patients and their symptoms and their responses to treatments. Additionally, it focused on tailoring interventions to fit the patient and integrating patient perspectives into decision-making. Thorndike influenced Henderson's theory by relating its principle of observing behaviors to her understanding of patients' needs. Henderson and Maslow also shared a parallel focus on addressing the needs of patients past the physical aspect, but also psychological. Henderson's need theory focuses on meeting basic human needs with emphasizing independence of the patient, with the goal that patients should be able to take care of themselves when they leave the hospital. The role of this nurse during the time is to support and promote health, but also fulfill their duties if the patient is unable to do so. Through physical, emotional, and psychosocial aspects, Henderson identifies 14 key needs that will be further discussed in later slides. The need theory also educates working nurses to empower their patients to take part in their health management and promotion when possible. Virginia Henderson had 14 basic needs that she identified in her needs theory. These 14 basic needs are essential for a patient's health and independence within the hospital and through daily life. The 14 basic needs also have a lot of similarities to Maslow's hierarchy of needs. Throughout this presentation, we will describe these more in depth. Virginia Henderson's first concept of her needs theory is breathing normally. Nurses need to ensure the patient is able to maintain adequate oxygen intake. This includes caring and managing for conditions that affect respiration and provide oxygen therapy. Also, nurses need to educate the patient on why they're giving oxygen therapy and how the patient can give themselves oxygen therapy and promote their independence. Her second concept is eating and drinking adequately. Nurses need to ensure the patient receives proper nutrition and hydration. This includes assessing dietary needs or any feeding difficulties. Nurses will manage the condition that affects their appetites and digestion and educate the patient on how they can incorporate different foods and movements that will help increase their appetite. This will promote their independence. Henderson's third basic need is eliminating body waste. Nurses need to assist the patient in maintaining normal bowel and bladder function. This includes support for issues such as incontinence, constipation, and urinary retention. Her fourth need is moving and maintaining desirable positions. The nurse needs to assist the patient in maintaining their mobility and posture, maintaining proper body alignment with movements, and prevent complications such as bed sores and contractures while in the hospital. Moving the patient often will limit these injuries. The nurse will promote physical activity by providing support for movement and education to the patient about their independence with movement. Henderson's fifth basic need is resting and sleeping. We need to ensure the patient gets adequate rest and sleep within the hospital and without. This includes properly medicating a patient prior to sleep to ensure a decrease in pain, a decrease in anxiety, and to limit other factors that disrupt sleep. Henderson's sixth basic need is selecting suitable clothing. This includes assisting the patient in choosing adequate clothing for weather, comfort, and all medical needs.
Henderson's ninth need involves avoiding dangers in the environment and also avoiding injury to others. This could involve protecting patients and yourself from unsafe situations, utilizing responsible decision making and avoiding unnecessary risks, and also understanding how your actions can affect others. This involves recognizing unsafe environments and decisions that could lead to negative outcomes, and also prioritizing other people's safety in the decision making process. The 10th need involves communicating with others and expressing emotions, needs, fears, and opinions. Encourage your patients to express their needs, fears, or opinions openly. Promoting optimal communication between patients and caregiver will help overall improve the outcome of the patient. This can be achieved by encouraging open dialogue in an environment where the patient can feel safe to do so. Henderson's 11th need points out the importance of worshiping according to one's faith. Acknowledging, respecting, and implementing the patient's faith, if applicable, into their care in order to best foster hope, reduce anxiety, and improve overall perspective in the nursing process. This can be achieved by promoting a positive patient outlook by utilizing their faith and spirituality as a source of hope and healing during the hospitalization period. The 12th need involves working in such a way that one feels a sense of accomplishment. This can be done by highlighting a patient's strengths and goals in order to best promote their sense of self-worth, confidence, and self-assuredness. Having a sense of purpose promotes increased self-image, positive outlook on adverse situations, and an improved state of mental health.
Henderson's 13th basic need is playing or participating in various forms of recreation. Encouraging the patient to engage in recreational activities that help promote relaxation and enjoyment. The nurse should identify suitable leisure activities and facilitate this patient's participation. This can help maintain the patient's morale while in the hospital and encourage activity outside. The last basic need is learning, discovering, or satisfying the curiosity that leads to normal development and health. The nurse should promote the patient's opportunities to continue growing and learning. The nurse includes education about their health conditions, encourages cognitive activities to promote learning, and support their cognitive development within the hospital and without. Virginia Henderson's model. Henderson's model is structured around the concept of caring for both sick and healthy patients. The model consists of concepts that promote health and also assist in healing. The theory emphasizes the nurse's role in helping patients achieve their own independence. First, you start by your nursing assessment. You assess the needs of your patient using her 14 components of basic nursing care. The nursing diagnosis will identify the individual's ability to meet their own needs with or without assistance from the nurse. Then you create a nursing plan and document how the nurse can assist the individual, sick or well, and how the individual can assist themselves. Through this, Henderson has identified 3 key nursing roles in patient care. Number 1, substitutive, doing for the patient what they cannot do for themselves. Number 2, supplementary, helping the patient when they lack the strength or will to do things on their own. And lastly, complementary, working with the patient to do things that they can do with just a little bit of help. Henderson's model was created to promote patient independence in the hospital and without. Using Henderson's model in practice, you use those 3 steps that were identified in the slide before. You assess the patient's needs and see which of the 14 are met and are unmet. The diagnosis determine the specific nursing issues related to these unmet needs, and then plan how you are going to address the unmet needs and aim for the highest level of independence, allowing the patient to assist in their care. Implementing this plan involves the nurse providing direct education, support, and assisting the patient in their own care. And lastly, evaluation. Assess the effectiveness of these interventions and adjust the care plan as necessary. In doing all of these steps, you incorporate the patient to allow for their full independence. Why is Henderson's basic needs theory useful? Number 1, it provides a framework for patient care. It provides guidelines for practice and a clear framework for assessing and addressing patient needs. It also allows for a holistic approach by considering the physical, psychological, social, and spiritual needs of a patient. Secondly, it provides patient-centered care, individualized care, and promotes the independence of a patient. Third, it provides nursing education and training, assists with curriculum development, and enables critical thinking skills for all patient needs. Fourth, it provides improved patient outcomes by providing comprehensive care and including all 14 basic needs that she has identified and enhanced recovery as a result of the focus of patient independence. Fifth, it improves patient and nurse relationships and enhances effective communication by meeting all the patient's needs. Sixth, it provides health promotion and disease prevention. And seventh, it provides professional development and role clarification through her theory between the patient and the nurse. This is an ethical foundation for nursing practice and supports the patient's autonomy.
The aim of this research study is to create and develop a comprehensive scale designed to assess the needs of care-dependent individuals. This scale integrates concepts from both Virginia Henderson's needs theory as well as Maslow's hierarchy of needs. Henderson's theory outlines 14 fundamental needs essential for health and independence, while Maslow's theory categorizes human needs into a hierarchical structure ranging from basic physiological requirements to higher self-actualization. The research study conducted involves creating a scale that combines these two theories through the following steps. First, item generation, where items were selected to reflect the 14 needs from Henderson's theory. Next, elements from Maslow's hierarchy were integrated into the scale to ensure comprehensive coverage of human needs. The scale was then validated by conducting a pilot study to further refine the scale items, and then using statistical methods to test reliability and validity, the scale was further tested. To ensure generalizability, a diverse sample of 776 care-dependent individuals were selected. The scale successfully covered all aspects of care needs, from basic physiological requirements to complex psychosocial needs, providing a holistic view of the individual's care requirement. Caregivers reported that the scale helped them identify specific areas that were needed that were previously overlooked, leading to more targeted and effective care. The scale demonstrated high reliability and validity, providing to be a practical tool for caregivers and healthcare professionals. Its use can lead to more personalized and effective care plans, ultimately improving the quality of life for dependent individuals. Henderson's theory is straightforward in its presentation, as it clearly and straightforwardly states the 14 basic needs, which makes it easy for understanding and practical application, no matter the level or experience of a nurse. However, it is complex in its scope, as these 14 basic needs cover the whole practice of nursing and Henderson's vision of nurses' role in patient care. The theory encompasses a wide range of nursing responsibilities, including psychological, physiological, sociocultural, spiritual, and developmental needs. The middle range theory of caring by Swanson is developed to provide a framework for understanding the caring processes that nurses engage in to support patient well-being each day. This theory focuses on the specific actions and interactions between nurses and patients that exemplify caring. The main concepts within this theory include knowing, being with, doing for, enabling, and maintaining belief. Doing for exemplifies doing for others what he or she would do for themselves if it were possible at all. Being with exemplifies being emotionally available and present to the other by conveying ongoing availability, sharing feelings, and monitoring that one providing care does not burden he or she being cared for. Enabling exemplifies facilitating the passage of life through transitions and unfamiliar events, through informing, explaining, supporting, and thinking through issues. Knowing exemplifies striving to understand an event as it has meaning to others, avoiding assumptions, centering on the other's needs, seeking verbal and nonverbal cues. Maintaining belief exemplifies sustaining faith in others' capacity to get through an event or transition and face a future with meaning. Swanson's theory of caring relates to Henderson's needs theory as it builds on the foundational concept of nurses assisting patients to achieve independence and optimal health. Henderson's need theory focuses on the 14 basic needs essential for health and recovery, while Swanson's theory provides a deeper understanding of the caring interaction that supports patients in meeting these needs. Knowing aligns with Henderson's emphasis on understanding the patient's needs through comprehensive assessment and patient education. Being with resonates with Henderson's concept of empathetic presence to provide emotional support. Doing for directly corresponds to the practical assistance Henderson describes in helping patients achieve independence. Enabling supports Henderson's focus on patient education and empowerment. Maintaining belief, lastly, echoes Henderson's holistic approach, which considers the physiological and emotional aspects of patient care. Overall, Swanson's theory builds on the foundational concepts and provides deeper understanding of the interactions. The middle range theory of caring was developed based on Virginia Henderson's needs theory. Swanson, 1991, provides a comprehensive elaboration on the caring process in nursing, grounded in the broader concepts presented by Henderson.